Hi, this is Dr. A with Intro to U.S. Healthcare, and we're going to look at Chapter 7 of the Basics of the U.S. Healthcare System by Nancy Niles, and we are looking at long-term care services. All right, so we're going to start with an intro and history of long-term care, types of long-term care services. So according to the Department of Health and Human Services, long-term care services include a broad range of health, personal care, and supportive services that meet the needs of older people and adults whose capacity for self-care is limited, usually because of a chronic illness, an injury, a physical, cognitive, or mental disability, or another health-related condition. Okay, so these people need help with all kinds of different levels of help with different activities, and they need it for a long time. So this is what long-term care services are all about. So most long-term care is not medical care, but rather assistance with the basic personal tasks of everyday life. So sometimes these tasks are called activities of daily living, or ADLs. They include bathing, dressing, eating, and going to the bathroom. So very basic tasks that you should normally be able to do for yourself, but some people require help in doing that. So the field of occupational therapy can help people with their activities of daily living, and you can be trained to do this. One of my siblings, my brother, one of my little brothers, does this for a job, and he goes in patients' homes to help them with ADLs and also instrumental activities of daily living, which we're going to look at right now. So that is another service that long-term care services provide. So these are instrumental activities of daily living. So they're a step above the activities of daily living. So instrumental activities of daily living are housework, money management, taking medications, grocery or clothes shopping, pet care, and using the telephone. So my brother also helps his clients with all of these activities. And so he will literally either take them with him to the bank, or he will go to the bank on their behalf to bring, papers or checks or different things like that to deposit. He cleans their house. He will go shopping for them, go pick up their prescriptions, and all the things that are needed while the person gets to stay in their own home. In 1722, England enacted the Poor Law, which created institutions for the elderly. So there were poor houses or alms houses. In the 1700s, the American colonies developed a nursing home institution in urban areas following that English model. This gradually led to the establishment of nursing homes throughout the United States. So according to the Kaiser Family Foundation, long-term care has evolved over the past 100 years to serve the needs of the elderly, but also the needs of those individuals who have a physical and mental limitation that preclude them from fully engaging in their activities of daily living or instrumental activities of daily living. And so even in my family, I have a cousin that suffered extensive brain damage during the birth process, such that in his mental capacity, he never developed past being like a toddler. Even though he lived to be 55. And so he lived in a facility for the majority of his life because, of course, it was too much for any one person to take care of. Can you imagine a toddler in the size of an adult body? It can be quite difficult sometimes. And so, yes, that's just one example, but there are people that need help and don't have family that are able to take care of them, and so they end up in a long-term care situation. In 1965, that was the first legislation, so a Social Security Act amendment established the Medicare and Medicaid programs. And Medicaid programs provided assistance for long-term institutional care. And this fostered the start of a nursing home industry. So the nursing home industry really started growing in 1965 and beyond because there was finally some money to help pay for these services. Now, if you remember, I know we've mentioned this yet, but and of course the chapter on financing is coming up after this section, after long-term care. But so Medicare and Medicaid. Medicare is for the elderly and some people with disabilities and stuff, and Medicaid is for people that are poor, don't have a lot of money. Okay, so if Medicaid is paying for long-term care, institutional care, this is for people that don't have a lot of money, so they have to meet an income threshold to be able to use Medicaid to pay for long-term care. But it did help fuel, now there was government provided monies, so it helped build a lot of the nursing homes in the U.S. In 1974, the next legislation is a Social Security Amendment that provided federal grants for states to support social service programs that included adult daycares and other health supports. So that was, about 10 years later, so saw that we needed things beyond just nursing homes. In 1975, another Social Security Amendment created Title 20, which provided assistance for home and community-based services. So again, now we're expanding long-term care, and we're going for payment for care at home and community-based services. In 1978, the amendments to the Comprehensive Older Americans Act required state to develop a nursing home ombudsman program and to develop community care alternatives to institutional care. So yeah, all of this is kind of moving apace, trying to expand all of the options available for long-term care. So the ombudsman is an official, usually appointed by the government, who investigates complaints. So those are complaints that usually lodged by private citizens, maybe family members of the person that's a resident of a nursing home. And it's against businesses. So here there would be the skilled nursing facilities or nursing homes. And attempts to resolve the conflicts or the concerns raised by the family members or by the private citizen. Then nothing really happened until 1990 with the Americans with Disabilities Act, which required state Medicaid programs to cover Medicare premiums for lower income individuals. And so when we tackle this in the financing chapter, you'll see that the Medicare that's paid for by your paycheck, the withdrawal from your paycheck, is only hospitalization. So if you want the other parts, Part B or Part D or even Part C, there's a premium that's required that needs to be paid. This act emphasized the importance of integrating individuals with disabilities into the community and work environments. Then it was followed by the Supreme Court Olmstead decision in 1999, and they found that the American with Disabilities Act violated the rights of persons with disabilities by keeping them institutionalized, resulting in the unnecessary segregation of people with disabilities, and this resulted in an increased need for community-based services. Again, people would rather be in their communities at home than being stuck in a nursing home, isolated from everyone. Then in 2000, the American Act Caregiver Program established state grants to fund family and informal caregivers to provide home care, so that these people who dedicated their time to take care of their loved one could have some pay. It's not really high, but it's better than nothing, because before that they were doing the care for free. And of course, if you're caring for a family member, it's difficult for yourself to also work, right? Then in 2005, the Deficit Reduction Act provided federal funding to states to expand community-based long-term care. So again, we're growing this community-based care. In 2010, we have the Affordable Care Act. It provided states with the opportunity under Medicaid program to improve their long-term care infrastructure. So if you think about it, with 1965, the boom and all of the nursing home infrastructures, so now these places are like, 50 years old, and they may need some update. And so this helped to improve those, but also maybe open new ones because they are, there's always a need for more. You have the boomer generation that's getting older, and there just weren't enough facilities for them. In 2013, the American Taxpayer Relief Act established a commission on long-term care, so to look at the issues and try to find the best solutions possible. In 2014, the Centers for Medicare and Medicaid Services provided new standards that community-based services must meet to be considered home and community-based. So they're starting to set some standards, and CMS also improved its 5-star quality rating system for nursing homes, which you can look up. So if you're trying to decide where to place a parent or a grandparent. So let's look at the types of long-term care services. So there are home care, community care, and housing programs for long-term care. So home care obviously is provided in the home of the beneficiary, of the elderly person. It can be provided by family, by friends, again, and it could be paid for that by volunteers or by professionals. Professionals are called personal care assistants or home health aides, and they assist with those activities of daily living. So they help the person get bathed, get cleaned up, get dressed, eat, all of the basic things. They do not perform medical care. They may take a patient's vital signs, just basic things. Short-term skilled care is covered by Medicare. Hospice care is often given at home for terminally ill individuals. And a lot of the home health agencies also have home hospice care. But we're going to dive deeper in the thing with Medicare only paying for short-term skilled care, meaning long-term skilled care is often not covered by Medicare. So community care, there are support services that include adult daycare centers, meal programs such as Meals on Wheels, senior centers, and transportation. So these are all, again, offered with the idea of keeping the elderly persons in the community in their own home with, their ability to get help with, certain things. And they don't have to need all of these things, right? Maybe they just need Meals on Wheels and transportation. Of course, the senior centers are great to be social and, to get to know other people in the community. But adult daycare centers are more for, seniors that are living with a family member, and that family member needs to work or needs some respite care. There are 4 general categories of long-term care institutional services. So these are institution as in we think nursing home, but there's a facility that they go to. This is not in their own home, right? So you have independent living, assisted living, skilled nursing facilities, and in memory care facilities, which are a subset of skilled nursing facilities. Okay, so let's look at each one, unpack each one. So independent living covers a broad range of settings for individuals who typically do not need regular healthcare services. They are 75 years or younger, and they can come and go as they please, but it's usually an apartment or something that's paid for. There's help nearby. They take care of things like maintenance and yard work. All that's taken care of, and security on site, and there's help nearby if needed. But generally, they're independent. They come and go. They live like if they were independent, but they're in usually some kind of facility that has other people that could be on independent living, but also at other like assisted living or other levels of care. So assisted living facilities provide 24-hour supervision and assistance with the instrumental activities of daily living. So recreational activities are provided, and depending on the state regulations, there may be some medical care assistance available. So again, they get help with things like maybe cooking or housekeeping or running some errands, maybe some transportation here and there. And so again, they usually have their own little apartment or residential area, or maybe a private room, but somebody is checking in on them regularly to make sure that everything is good. Now, skilled nursing facilities are really what you think of when you think of nursing homes. These are care for residents who cannot live independently. They typically, these facilities have age restrictions, they have increased security, and they do offer a range of social activities. There are 15,500 Medicare and Medicaid certified nursing facilities nationwide. Now, the memory care facilities are a type of skilled nursing facility. They focus on patients with dementia, Alzheimer's disease, and other cognitive issues. They have more supervision than the skilled nursing facilities, who already have like a really high level of supervision. And they have staff for these patients, and they have alarm security and tracking devices to protect the patients, because patients with dementia and Alzheimer's and all that tend to wander, and they may try to leave the facility, etc. And they're easily lost. So this last slide kind of captures the senior living spectrum. So going this way, the cost increases, and going this way, the level of care and supervision increases. So adult daycare is a pretty low cost, not a lot of supervision. In-home senior care is the lowest cost, and you can have all levels of care and supervision depending on what you need. And then we have independent living here. Again, the independent living costs the least, but it also doesn't have a lot of supervision, like active senior or senior co-ops, so more like all independent living. These can happen also within the realm of retirement communities, with senior apartments, which they have total freedom with access to other seniors, have very little supervision. The cost goes up a little bit. The retirement communities can be a little higher, and then those continued care retirement community we'll talk about here in the last video on trends in long-term care. I think these two should be flipped, or at least this dementia one should be over here, because the dementia and Alzheimer's care do need a lot of care, at least a lot of supervision, and the more care and supervision you need, usually the more expensive these things are. Hospice care is a little bit lower cost, but a lot of supervision. Also, hospice care is a lot shorter, right? It's a type of long-term care, but usually once people are put on hospice, they don't have a long time to live. So, and here in the middle, you have personal home care, assisted living, and respite care. So, kind of gives you a snapshot of everything in one slide. Okay, our second part of the lesson coming up is going to be on how to pay for long-term care services.